right, thank you so much for joining us today. This is our bi-monthly webinar session from the International Institute of Healthcare Leadership and Quality Assurance. Our goal is to raise transformational leaders across the healthcare landscape in Africa. And by transformation, we mean the capacity for leaders to be able to rethink, relearn, and rebuild our health system. We want a different outcome. We want a healthcare system that deals with maternal mortality rate, that reverses the trend that we've seen over decades. We want to achieve some great results in different forms of care. And so because of this, we are passionate about raising leaders across different professions across Africa that is able to drive transformational leadership. And we have an excellent scholar today who is going to take us through a topic that is so near and dear to healthcare transformation. And that's confidentiality and privacy in healthcare. And because we are in a digital world, there's a lot that has to do with the legal implication, the technology implication, and different forms of social, political, economic implications that has to do with confidentiality and privacy in healthcare. But today we're honing into navigating the challenges of electronic health records. We'll analyze the ethical and legal considerations surrounding patient confidentiality and the use of electronic health records, including data security and access control. Would appreciate you for your time joining this session, and I would be yielding to Ms. Abimbola to please read the profile of our guest speaker. Thank you.
Thank you very much, sir. Good evening, everyone. My name is Abimbola Liede, and it's my pleasure to introduce our keynote speaker, Dr. Ife Oluwayemika Bamidele. Dr. Bamidele is an associate professor of law at Afe Babalola University in Ado-Ekiti, where he specializes in medical law, health law, and public health law. He holds a master's degree in law, medicine, and healthcare from the prestigious University of Liverpool, and a PhD in law focused on patients' rights. In addition to his academic achievements, Dr. Bamidele leads the Department of Private and Business Law and consults with regulatory bodies such as the MDCN, GMC, and SA Ombudsman. He is a key promoter of the FCCPC Patients' Bill of Rights in Nigeria. As a renowned expert in his field, Dr. Bamidele provides legal expertise to medical and health practitioners, institutions, and patients. He is a sought-after speaker at seminars and conferences, known for his advocacy and scholarship in health and medical law. Please join me in welcoming Dr. Ife Oluwayemika Bamidele. You can learn more about his work at www.bamidele.com. Dr. Bamidele, sir, the floor is yours.
Am I on now? Thank you. Can you hear me now?
Loud and clear, sir.
Okay, thank you much. I'm sorry, I'm having to do this on the move. I when the lead speaking about talking where we are at, and he mentioned those of us who don't live where who are currently where we don't where we're not living. So when they mentioned somebody who is in Ado-Ekiti, I expected that you would imagine that I'll be in one of the farms in Ado-Ekiti currently, trying to grow food for the nation or speak to practitioners. Unfortunately, at this time, I'm trying to see if I can get out my slides and share it immediately. If not, I'll carry on, and then in the course of this presentation, I'll share it. In some hours ago or minutes ago, I just had the privilege of witnessing the opening ceremony of Olympics. But as I speak to you, I'm speaking from somewhere in one of the villages in London. But here today, we are speaking on medical confidentiality. I'm speaking to professionals who probably have some more knowledge about this discussion than I do. However, I've been privileged to teach and consult for professionals, medical professionals in healthcare systems, nurses, doctors, medical laboratory scientists, healthcare managers, hospital regulators, administrators, and the conversation has been very huge around confidentiality. One of the questions we continue to ask ourselves is confidentiality still a real thing? Are we still going to be discussing confidentiality in this age and time when we're talking about electronic health records, we're talking about data privacy? Is this something that we're still even going to need to talk about now that everybody's posting, sharing? Somebody's on the way to the hospital. They've done a TikTok before they get to the hospital. They ask the doctor to do a video of them trying to take their medication or getting some blood or doing something. So the question will be whether or not confidentiality is still part of the discourse. Sad part about one of the things with my trip is that somewhere along the line, I think that I'm still looking for my computer, but I hope that I find the one that I'm looking for immediately. I want to say a big thank you to Dr. Ide for the privilege and for everyone who is part of this meeting, all the organizers and team members here. I just want to say thank you to you. And I really would like this to be a discussion that we can all participate in so that it will be easy for us to communicate. I am more open to questions, queries, discussion, anything that you have to discuss on this, because it's easier when the people who are part of the team participate, when you ask questions. So I'll just have like an introductory statement. Is there anyone who is kind enough amongst the participants who knows or wants to talk about why do we actually have this conflict? Why is confidentiality a conversation to have? Is there any good reason for confidentiality to be a discussion? I know that in med school and I did an LM in law, medicine, and healthcare where doctors, medical professionals, surgeons, and senior other healthcare providers were part of the team. And so there's the generic discourse around confidentiality. But at this time in your practice, on a daily basis, is there anybody who sees why confidentiality? The first question I asked in my slide, I hope that I'm able to use this device because I'm trying to connect to the office, even though I can't find the device that has it immediately. But yeah, so why confidentiality? If anybody can help us. Any chance? Is there somebody who's willing to bell the cat? Just so I know that I'm not speaking to myself. Ah, I've not been privileged enough to have anybody take up the mic. If you are willing to speak, please unmute yourself.
I am Joshua.
Okay.
Okay, please go ahead. Okay, why
Yes, I'm listening.
confidentiality? The first
Yes,
reason that comes to mind is for patients to be able to trust us as healthcare
good.
providers, because
Yeah.
we have access to their sensitive information, uh, private details that probably they wouldn't want anyone in the community or society to know. So that's one. Number two, of course, quality of care. Number three, the legal and I think ethical implications or obligations that each healthcare provider has for to the government and to other regulatory agencies. And then maybe the professional reputation of for all of us as doctors or practitioners. And then for patients to have their own autonomy. I think for those reasons, for me, that's why confidentiality is great.
Thank you so much for your intervention, Dr. Kolawole. I appreciate the fact that you will have been the speaker for this event. If not that they've already invited me, I probably would have asked them to invite you, and then you will have resolved. You will have probably resolved this. But let me say this. I was asking earlier, what parts of the world are we speaking from? There's a presentation that we had just at the World Medical Association WMA event that just held somewhere some days ago, and there's this discussion around confidentiality and trying to gauge what confidentiality means in different jurisdictions. But one of the things that we uniformly talk about in confidentiality is the source of confidentiality. Where does this confidentiality discourse start from? And that is from the Hippocratic Oath. When most of the people who become medical professionals become medical professionals, they start by saying, oh, I'm going to keep the secret of my patient. If you look at the Oath of Hippocrates, you'll read something as part of it that says something like, well, whatever I shall see or hear in the course of my profession, as well as outside of my profession, in my intercourse with men, if it not be what shall be published abroad, I will never divulge, holding such things secret. So the question to ask ourselves is, if you have already sworn to an oath, you've already told yourself you are not going to share this information, then what happens when there are situations, circumstances that now require you to share information? Because usually we don't have doubt as to the need for confidentiality, like he said. But the question is, the problem is what information? The first question I asked was why? The second question will be who? Whose confidentiality? So is it everybody? For example, if I was the president of persons living with HIV and AIDS in South Sudan or in South Africa, will you be worried if you told my story to somebody? Will I be your patient? Somebody is speaking from Missouri, somebody is listening from Houston, Texas, and somebody is listening from somewhere in Spain or Germany. Somebody just dropped a message and said, in my opinion, it's important for the patient in order to reduce the stigma attached with the disease. Thank you for answering that question. I'm happy that we're following. So I spoke firstly about the why, the Hippocratic Oath. You have already sworn to an oath. Some of us have other oaths that we're sworn to, depending on what your profession is. There's also the physician's oath. And remember, there's also the Code of Hammurabi, from which most of these oaths have already picked something. So in most of the medical professions, physicians, healthcare professionals, nurses, pharmacists, most of us who are in healthcare and allied professions have sworn to an oath to say, I will keep the information. The question is, what now happens? Because the reason you are keeping the information is because it's an ethical duty. It's a legal duty. The law says that you must. For example, in the country, one of the countries where I practice, there's the Code of Medical Ethics, there's the National Health Act, all these things are in my slides. Immediately after this session, I'll be able to send it if I'm not able to send it in the course of this session. But the question will now be, in your own jurisdiction, most of the international laws still apply. Whether there is a local law that applies or not, there is international laws and policies that guide patients' rights to confidentiality. But the real issue here will be, when can you disclose? We all accept and admit that confidentiality is an ethical duty. Confidentiality is a legal duty. The laws ask you to keep confidentiality. I just read part of the Hippocratic Oath and the Physician's Oath. And even in the Physician's Oath, it goes as far as saying that I will keep the information of my patient even when the patient has died. That becomes a challenge. So we're going to look at some of the issues that may arise in the course of keeping confidentiality. Now, when can you disclose? Because whose confidentiality? Why confidentiality? First one, the confidentiality, the reason is ethical, it's legal. Second is whose confidentiality? My patient. And those are some of the issues that we have in confidentiality. At what point does a person become my patient? Especially with electronic health records, especially in this era of online doctors, in this situation of passing information across. When does a person become a patient? Barnett and Kensington Healthcare Service, there's a popular case but because I'm not talking to lawyers, I'm not going to go into the details of the case, and especially because of the time frame that we have. But I can assure you, if you look through the document that will be sent to you, you'll find sufficient information. Now, when can you breach confidentiality, or what are the variations of the obligation of confidentiality? One of them is consent. And this becomes a conversation, especially where that consent is not explicit. So when there's explicit consent, or where consent is informed, real, certain, sure, a person is able to say what it is, they're able to write what it is, they're able to discuss it, it becomes very easy. You say, oh, this person has told us to release that, either for the purpose of a research, either for the purpose of growth. But where that consent is implicit, that is, a patient walks into your clinic, walks into the hospital where you work, and you tell them, oh, I'll send you over for bloods. He expects that the person who you are sending a note to from your computer to the labs, they already have information about what type of testing they're supposed to do, what level of information they're supposed to have for them to be able to adequately care or cater for the patient. Now, where that information is implicit for care or for the proper working of the hospital, then it becomes easy for the patient to say, oh, that consent for confidentiality. But patients have queried, I have had 1 or 2 cases where patients have queried sharing of information with healthcare workers, hospital staff who do not have any direct impact or input on patient care. Now, in some instances, it is justified by law. And I usually use the case of Tarasoft versus the Regents of the University of California. Now, you are a doctor. Imagine that you are my doctor. I always use myself as example when I teach doctors in law and medicine, in healthcare law, and public laws. And I come into your clinic and I tell you that maybe mental health department or in any of the units, and I say, doctor, do you know how I feel at this time? There's a Zoom meeting that I'm coming into at 7 p.m. Now I'm going in with one of my guns. And immediately I get into that meeting. Let us assume that this was not a real Zoom meeting and it was a physical meeting. There's 14 other people who are with me in this meeting, and I will shoot all of them. I will spare one of them though, because there's only one person who has successfully answered my question. Although there were 2 people who attempted, I'll shoot the other second person who attempted in the leg and not in the head, so that probably the 2 of them will survive. Okay, there's another person who has sent a message. I'll also speak that in, shoot them in the arm. Now, if as a doctor, you have this information prior to that meeting, a physical meeting is holding, and once a certain doctor, if Bamidele has said, he will be going into the meeting and he will be shooting people. As a doctor, in the course of confidentiality, will you be able to release that information? Who can you give that information to? And if you have given that information, have you breached confidentiality? Before I go on, I would like somebody to speak on that so that we can proceed on our conversation on confidentiality before we get to electronic health records and some of the other conversations. Thank you. Anyone speak?
All right. Good evening, everyone. I'm Dr. Oneide. I believe
Yes, please.
once the patient become dangerous, either to people around or the community, it is also my responsibility to look for how to ensure safety within the context of not violating the right of the patient.
Okay.
And I think
Thank you very much
that,
for your. Yes, please.
okay, I think
Carry on. I'm with you.
A rider to that will be public health significance of whatever information you get to have would determine to what extent this concept of confidentiality we have to be. Because similar example is if you have a foreknowledge of someone who has COVID when COVID was still a big deal, and the person is actually going to attend a program, and he had told you, I'm going to attend this program, and you know the guy is infectious at that time. So what would we do?
Yes.
So I think even security agencies have to deal with these issues daily. So For the purpose of public health, then the confidentiality of the patient may be managed, but the intentions would have to be disclosed to appropriate authority. That's my own thinking.
Okay. Thank you very much. You're very correct with one of the things that you said. And let me say that one of the exceptions or variations of confidentiality is public interest. Public interest is, however, determined by the current situations or circumstance at the time. So there was a time when having being a person living with HIV or AIDS could be something that needed to disclosure either to family members. However, at this time, the confidentiality levels have increased, meaning that information is no longer relevant for the people. At the time when COVID was an infectious disease, it still is, but at the time when it was raging and communities and nations were being hit hard, if your patient had it, the level of disclosure that was required is higher than what is at this time. So it means that Joe Biden had COVID some weeks ago. That information was relevant because of his role. If I was the one who did, the only set of people who require disclosure are people who are at risk or at-risk persons. So that's why in electronic health records, for example, in one of my slides, I was talking about contact tracing apps and some of the issues with regards to confidentiality. So you mentioned COVID, and one of the things that happened when we were having COVID was that many of us filled forms. When we went on flights, when we traveled, you write your name, you write the seat number you were on a particular aircraft, so that if there was somebody who was seated close to you, if you were at risk of something, then this information will be required to be shared with you, or your information might have been required to be shared with another person. Now, with HIV and AIDS, confidentiality in that sphere is a big conversation. In South Africa, there's a lot of literature around process and procedures. And I keep telling people that in many of the Black and minority ethnic nations, we need to still develop procedure for disclosure. So I bring a scenario in your head. Two people walk into your clinic. They say they're going to get married next month. And then you go for procedural testing. They do some of the tests, including HIV tests, blood groups. And then one of the partners come back and then they're positive for HIV. Now, as a medical practitioner, are you expected to disclose to the partner? If you are not expected to disclose to the partner, how are you supposed to protect the other person from the situation that they may find themselves in at this time? But we'll get to that question. Please pin that question somewhere, and then I'll be expecting somebody to answer that question. It's a poser, and I'll be looking forward to your own opinion and maybe for your own solutions for your local medical association or for the nation that you are currently a part of. So in addition to consent, we also have justification by law. So in some unique situations, we have hospital policies, we have national policies, we have state policies that allow some form of confidential information to be released, either for public safety, in public interest, or required by law. So there are things that in some countries, for example, if you find a woman or a child who has been battered, who has been abused, you are expected to report. If you are treating a child, for example, you're treating a minor, and then you find out that there are things that you should not find. If this child has been abused or has been molested, then you are expected to disclose on the basis of justification by law. In addition to justification by law, one of the things that we're watched over is public interest, confidentiality. So, but in public interest, one of the challenges that we always have with public interest is in determining what is public interest. And public interest may change per time. So it means that whilst public interest may be easy to determine when a situation is going on, it becomes more difficult for us to be able to say what public interest is depending on the jurisdiction. If a person threatens that it will cause harm on a weekly basis, will you be willing to disclose their private information? If what they're saying is not something that is deep, or if it is something that does not require their family members to know, are we supposed to? What is the age of the person? And lastly, I talk about capacity. So one of the important things that we look at is with capacity. We ask ourselves, does the person have capacity to give consent? This information, that's where we talk about children. We talk about children, we talk about persons living with some circumstances or situations, persons with low intellectual capacity, elders who cannot make decisions, persons who are debilitating or conditions or circumstances that make it difficult for them to be able to make certain medical decisions. So these are situations or circumstances that we find ourselves in where the law permits that you may disclose information. Like I said earlier, depending on jurisdiction or law place where you're part of, you can have the Nigeria, for example, we have the Medical and Dental Practitioners Act, National Health Act, and different sections of them, as well as the Code of Medical Ethics that talk about protecting the privacy of the patient. The legal requirement, for example, the EPA in the United States and the GDPR in the EU talk about what is expected with regards to patient information, and not just patient information, all the people who pass through your healthcare facility, the level of management of their information, it's important. Like one of the parties said earlier, there's trust and power in healthcare settings. One of the most trusted professions, there's one of the polls called the Ipsos Mori polls, and this which is one of the most popular polls that take place on an annual basis. The Ipsos Mori polls tries to check which professions are most trusted on an annual basis. They place politicians alongside teachers, lawyers, doctors, and different other professions. In that case, in most of the years, we'll find out that doctors and healthcare professionals still top amongst those who the citizenry trust the most. And so because of this, trust and power in healthcare professions and the imbalance of power mean that doctors must be able to keep the confidentiality of their patients. Now, with technology, we bring about a very different scenario. A very different scenario. Why is technology different? Because with confidentiality discourse before, it had to be a mouth-to-mouth discussion. The person had to say something to another person or show a person a document. However, with technology and confidentiality, the first things about electronic health records. So it means that with the touch of a button, I can share his medical records and it will go all over the world. All I need to do is do a video and say, do you know that there's one Dr. Onide who is on this call, and I should let you know some of the things that he's doing. Although he's making us feel as if we are the only people who are bad people, check out his medical records. Or I can say, oh, Joshua Kolawole, who is speaking to you, who you think has not done any bad in this world, I will show you his medical and some of the things that he has done in the past, including some of the medical procedures he has undertaken. If you are from Southwest Nigeria, somewhere in Africa, one of the most populous nations in the world, you will remember that there was a political situation that occurred some years back where a political aspirant went in an announcement and said, oh, my successor, or the person who is trying to contest with me, has a case file at one of the mental homes. People randomly mention and say, oh, this person has been to a particular medical facility. A doctor was suspended by the Medical and Dental Council for releasing the information of a particular citizen when there was no need to. It came out in public on social media and divulged information. In one of the cases, another doctor was suspended for releasing the information of a political, an elected governor. And that information was not relevant to the public at the time. So we find ourselves in certain circumstances and situations where technology either aids the protection of confidential information or makes it easier. For some, they have said, oh, technology is the solution. All our health records are managed easily. Once you come in, so many hospitals are currently going paperless, meaning that instead of having case files, you're bringing in cards, you just have a digital number, you have digital records, and then you're able to keep the information. So the place of electronic health records and data privacy, like I mentioned, the EPA talks about how information should be protected and how data should be protected. Now, many countries around the world have data protection laws. Data privacy is a current global discourse, and medical professionals and healthcare professionals are not left out in the discourse around data privacy. The danger in releasing information about patients to the public is that the level of trust that they have in the medical profession will begin to reduce and it will begin to drop. And the trust in the profession will be affected, not just because of a particular patient, but because of the multiplicity or ripple effect that it can have on patients. Now, we have apps. Many people now use many health apps. For example, some of us have apps where we save our health information, our blood pressure, our heart rate, Some women have apps where they put their ovulation times there. So it means that before now, it used to be just paper and a few digital records, but a lot of medical information is now going on apps, on websites. We have online consultations for doctors, online consultations for pharmaceuticals, online consultations for different areas of the healthcare profession, and your information is beginning to get more available on the internet. Now, if the information is available on the internet, it means that it's at risk of those who are hacking the information, it's at risk of other individuals or professionals who may not have need to access it. So what do we recommend for hospitals and medical facilities, as well as medical professionals, some of whom are here in this program at this time? One is that there must be a clear policy for professionals in the workplace. Your hospital, your institution, if there's none currently, you can develop one with either a legal practitioner or with someone who has knowledge of developing policy. So how do we share information? What level of information are we expected to share? Either with the patient, with patient's relatives, with patient's family members, with other members of the profession in the team, in the hospital, for proper workings of the hospital, with police, for example, with security institutions and security agencies, with at-risk persons. How much information? You go to some hospitals in different parts of the world, and then you say, oh, people with this particular disease, come this way. Those receiving this particular treatment, sit down in that place. Have they breached confidentiality? There's a current ongoing research that we're doing with both some institutions in the United Kingdom, with some hospitals in 3 countries in Africa, talking about confidentiality. And the preliminary data shows that many professionals, although they are aware of medical confidentiality, they are not conscious in their day-to-day activities and running of hospital in ensuring that they protect the patient's right to confidentiality. So with research and ethics, it is important that you get ethical approvals to be able to get consent and when you're going to release the information. I mentioned that research with regards to some of the information that we're doing, but before we can get that information, we have to get ethical approvals for research, and then you ask patients and say, would you be willing that I share this information? Imagine that a doctor on this platform now, we just finished this training, this discussion, and then after the discussion, I have a consultation with you. And then at the next discussion, you tell everybody on this platform and tell them that, do you know that Dr. Bamidele, who spoke with us last, do you know what he's battling with? His health is in a mess. Stage 3, that is what he's facing. And I've spoken to him. I hope that he will listen to some of the advisory I've given to him. Will this information have been necessary for this group? With confidentiality, one of the phrases that I use, and I want you to listen to that phrase. I think I added it to my previous slide, but I'll add it to this other one when I'm sending it, is that we must be able to distinguish as medical professionals between what is in public interest and what is interesting to the public. British Steel and Grenada. There's a popular case talking about the distinction between what is of public interest and what is interesting to the public. With today, I was trying to, in preparation for this discussion, I tried to collate in the 3 to 4 years, not doctors suspended by reason or access information that was supposed to be today. In my long list, although I've not completed, I have about 10 or 11 doctors who have faced a fitness panel or a disciplinary
Hi, Tim. Is it only from my hand? I'm not sure I can hear him again. Can you do a thumbs up if you can? And a thumbs down if you cannot. Can you actually hear me?
I can hear you.
Oh, okay, great. You're back. Okay,
I want
please
to be
go.
sure that you can hear me as well.
Yeah, I wasn't able to hear you for a while, so I wanted to check in with the
I think
team.
that you lost me for like 1 minute or two.
Correct. Thanks. Please,
Yes.
you can go
So
ahead.
I'll say that in some of the research that we've done, we hear that the challenges that are faced by medical practitioners in ensuring patient confidentiality include the inadequacy of facilities or the fact that there are not enough staff, the number of patients managed on a daily basis, the method of keeping records in different facilities that we work at, as well as the lack of policy or open record system. So it means that administrative officers, staff who are not supposed to have access to the information have access to the information, and they may disclose or share the information even without the consent or permission of the lead medical practitioner or the healthcare manager who is in charge of the facility. These are some of the challenges, and then maybe in some systems we have corruption depending on the nation that you are yourself in. If somebody asks in your hospital today and asks that they will pay $1,000 for someone to get the file of one of your patients, how many patients' information do you think will be available? In some countries of the world, people pay for data or information, harvesting information about specific patients, and are willing to pay as much as possible depending on their interest. Some celebrated cases about confidentiality have been usually from stars, either movie stars, music stars. There's a popular case of Campbell and Mirror Group newspaper from Naomi Campbell's case on confidentiality, and the court re-emphasized talking about what is expected of the both the medical practitioner, the press, the public, and how to guard public information. I think that I've set a background, and I want to take your comments or the questions that have come earlier. I think that there was somebody who sent in a message shortly before it went off, but I'm not sure whether I can access that message anymore. And I would like to take that and then the uh, the those who are already in practice or who are current professionals, how do you really handle cases that require either or protection of the party against adverse? Waiting.
Hey, I thought I was the only one having the network issues, like not hearing him properly, but it looks like someone else is confirming that. Okay, he's back. Uh, uh, Doc, please, can you go over the last set of statements you said? It was a bit difficult to hear you. Dr. Bamidele, if you can hear me.
I gave a poser earlier about a patient to clinic or as a physician, and information that the patient is infected or the person that lives with HIV or AIDS, and the patient who can be is at risk of contracting the virus. How and I use the example of couple and
Yeah, I'm not quite sure I got the full question, and that's why it's a bit difficult. I would have dropped it in the chat. If we have someone who got the full question, if you could actually type it in the chat, that would be great so that we can then discuss it. Anyone who got Yeah, I also couldn't hear him, can't hear him again, but I think he's joined,
You
he's
hear me
joined.
now?
Yeah, I can hear you now.
I'm not saying why it keeps logging me out, but I apologize for that.
Yeah, I think it's the
So I
network.
wanted to take feedback from practitioners on how you would handle where you are a physician and you have convincing clinical information about a patient who has HIV or AIDS, and they have somebody who is an at-risk person of in danger of contracting the virus. How do you manage that information, or would you disclose that information? Are you expected to in your jurisdiction or in your work? Can everyone hear me?
Yes, I can hear you. I think I'm trying to put a high-level summary of the discussion in the chat, so that you're a
Oh,
physician, someone is at risk of contracting, oh, I just said the virus, but I mean HIV virus, right? And you have the
yes,
privilege, foreknowledge by your profession. How would you handle
yes,
such?
yes.
Great.
Because people are faced on a daily basis with practical issues. When we talk about confidentiality, it's about the practical nature of the information. So what are our current experiences? I'll give another pose out with, we mentioned HIV. Those are some of the naughty issues. We mentioned HIV. There's also persons who lack capacity. There's children. If a child comes into your clinic and the child is 3 months pregnant and the child is 15 years old and they do not want their parents to know, what do? Do you keep their information confidential? Do you speak to child services? Do you disclose this information to their parents? These are some of the naughty issues in confidentiality.
Okay, I have the second one also typed in the chat. In case of lack of capacity or as a minor, of course, and the minor is
Yes.
pregnant, how do you handle this in practice? So please, Kubita Idris, please go ahead. I see you raise your hand.
Okay. Are you people get me well?
Yeah, we can
Yes.
hear you. And please introduce yourself.
Okay,
We
thank
want
you
to
so
know
much.
what your background will be, a doctor or what profession, please.
Okay, thank you so much. My name is Kubita Idris. I am currently in Juba, South Sudan. I am a clinical officer and a fifth-year medical student at IU University.
Excellent. Thanks.
I would like just to respond to my to the question that was asked. I know I didn't practice enough, but from the knowledge I have, I would like just to explain some of the. So one of the things about the confidentiality, like we know that all the professionals are expected to always maintain the confidentiality of information obtained through their work, unless there is compiling reasons to disclose it. And to me, for example, for the case the doctor has just given, if a child comes to your department or your clinic and you found out that this child is underage, for example, 15 years, she's pregnant, and by professional ethics, you're supposed to respect the right of the patient. You're not supposed to disclose the information to the patient. I mean, the information of the patient to other relatives or other people, for example, because then you breach the confidentiality. But to this extent, a 15-year-old child who is pregnant at the same time need a lot of care from families, need a lot of care, need attention, so that she's able to maintain this child, she's able to take drugs that will help even to reduce the cross infection. So to me, I know, and that's the reason why they're saying to some extent, there's some reason to disclose. Why? Because the family have to be part of the caring to this child. And I know, despite the fact that it is now going to contradict, and that's why there are some dilemma situations whereby you are faced with a 2 or 3 conditions that you must make a decision on. To me, I feel like for this case, you will involve the family, because without the family knowing, you don't know what's going to take care. You don't know what's going to happen. Will this child going to take the drugs at home? Is he going to comply with it? What about other cares? Okay. So to me, that's what I feel. You will have to share the information to the family with the main reason that they have to take care of this child because it's underage and he has to be monitored on taking drugs. He has to be taken out for very lot and all this care. So I think it's important. And also to some extent, a child who is underage sometime, the parents you have to take consent from the parents as well. So to me, this child is young, and if they are not able to consent themselves, I think parents who are knowledgeable should be informed of that. Otherwise, I think this is my little response. Thank you so much for the chance.
Thank you very much. I think there's still some 1 or 2 hands raised. I want our host to consider that.
Yeah, please let them go ahead. I can't see any other hand raised currently, but maybe they were raised in the past. But there's
Okay.
also a chat.
If there's no other hand raised,
the question
yes,
is it that
please, if you
can you hear me, sir? Hello?
Yeah, we can hear you. Please go ahead.
Okay. The question is it termination or
yes,
clear? But the question is too clear. Is it to
yes, we can clearly.
Is termination involved?
You can answer it in all directions you think should go. It could also mean just to let the parent know, and it could also involve termination of pregnancy, depending. So whichever way you think or dynamics you've been seeing in your practice, please let us know. We're also learning from your experience.
Okay.
So please go ahead and answer from your perspective, sir.
Can we hear him?
I'm not sure I can. Or maybe he wants to use the chat.
Okay.
You're good to use the chat.
Okay.
If you don't want to, you can just give us bullet points in the chat. And please, others too, feel free to chime in at this point, either in the chat or you can just unmute.
So at this time, under the IPA, which is one of the also general rules that we follow at this time, disclosure to the patient, the general request is to encourage the patient to disclose to persons who may be at risk. That's the first line of charge. That is, if you are the person who has a situation and other people may be at risk, they ask you to confirm with the person and say, oh, tell your partner or tell the person by yourself before any service informs them. However, if they are at risk in public interest, the hospital services may be required to pass the information across to the person. However, in a very subtle manner. For example, in one of the trusts that consulted a team that I was a part of to draft a sample letter for such disclosure of information. The letters looked something like this. Dear dash, 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 the name of the person. You might have been at risk of contracting ABC. You are recommended or required to take a test to show whether or not you are A or B or C. That's this mentioning the specific disease, and then say that the trust or facility is in your interest. Their desire is that you be of health, and that they believe that testing yourself, knowing what your status is, and being like conscious of the indices for A, B, and C will put you in a very great place. So whilst immediate disclosure has not been made to the party, that party has been nudged. That trust decided to use a preemptive mode to be able to pass the information across. To say, you might, if you have somebody who has one partner or two partners, you might now begin to check out your partners and say, well, which one of you has gone to test something? In some other cases, you are expected to disclose, or you get a permission to disclose. But the advisory that I give to medical practitioners, which is the one that the General Medical Council gives as professional advisory on confidentiality. If you check the GMC, the professional guidelines also have one on confidentiality, which I can share with the House after this presentation. And it's talking about with adults who have capacity, with children, and different other categories. Now, with children, there's the Gillick competence rule, which is the case of Gillick and West Norfolk Area Health Authority, and talking about making medical decisions. So in many other countries of the world, whilst those of us who are in Africa and other developing nations still see persons who are below 18 as unable to make medical decisions, in many other parts of the world, and I must say also in South Africa as well, we have a lot of young persons who are capable of making medical decisions and who the medical practice must protect. So persons who are Gillick competent, although the age may not be at 18 years yet, they have been able to make medical decisions. They'll be able to show capacity to be able to make medical decisions. They know the import of their decisions. So their consent is informed, their decisions are informed. They are not only making a wise decision, note that they are making a clear decision. In RET adult treatment and REC adult retrieval of treatment, we talk about medical decisions and medical refusal of medical treatment. I'm sure that we'll have one of these to talk about that. We have a plethora of long list of cases in Nigerian courts of persons who have refused treatment, including when the doctor thinks that he has saved the life of the patient, the person goes back to court to say, so sometimes your decision to save life or do the seeming right thing can still put you in trouble. So the reason we're having this particular conversation is to ensure that practitioners, doctors, those who
Hi, can you hear me? I couldn't hear him for a while now.
I'm not even getting him as well.
Okay, great. At least just to be sure you can hear me. Thank you. Okay, while he's trying to join back, trying to reach out to him. Yeah, I think the network, he said he's in a village in London, actually. That's to show that network disorders are not specific to a zone of the world. It could happen anywhere. Okay. So, Dr. Eki, you were talking about these are the issues that you faced daily in your practice, especially as relates to termination of pregnancy for underage, for minors. Could you share from your experience how you've been able to deal with this in your own in your environment, and what are the laws of the land that you're leaning on? Can you hear me? Okay, I think Dr.
Yes.
Bamidele is okay. Yeah, I think Dr. Bamidele is back. Okay, Dr.
I'm
Eki, are you?
sorry, I'm not sure why we lost me for the length of time. I'm not where we lost for that length of time, but
Dr. Eki, you're on mute if you're
I'm not
trying to
sure why we lost
speak.
me for that length of time, but I'm sure that this meeting is supposed to end in some minutes. Can we take two questions, if it's possible? I just sent a link to Dr. Nide from the GM. UK Professional Standards for Doctors' Confidentiality and Disclosure for Protection of Patients, which I recommend that we look at our time. So if I can take 2 questions, I'm not sure it's logging me out, but for whatever it's worth, I'll be happy to take at least 2 questions before and then I'll send in the other documents. As a link that I have sent from
Hey, Dr. Eki, let me get you unmuted. I think I can unmute you. I don't know. Or it should ask you to unmute now if you can confirm that. I think you're trying to speak. Okay. I cannot hear you, and it looks like you're still on, as in you're muted. If you can unmute and speak, it will be great. Okay, please go ahead. I think you're on mute.
Hello.
Hi, thanks. Please go ahead.
Okay. Can you hear me now?
Yeah, I can hear you now.
Yeah, these are a very common clinical scenario. As an OBGYN, usually people under the age of 18, they might have these unplanned pregnancies and they came for termination without notifying to the parents, right?
Correct. Okay.
And especially if it's like second trimester, that may happen with some complication during the termination. It's a must for them to involve one of the family members. It may not be really the parent, but at least a guardian or someone with the family, a close relative, has to be involved in the decision-making process, because we cannot be sure what's going to happen during the termination process. Sometimes complication may happen.
Wow. Okay. What's the law of your country? And sorry, just to get it, what country are you speaking from? And then what's the law of the country?
Even though currently I'm out of Ethiopia, I'm from Ethiopia. Basically, I'm talking about that.
Excellent. Yeah. So do you have any national framework or legal understanding that protects you as a physician, as a gynecologist now, to go ahead with the termination of?
Yeah, these things, these days, it's thought to be about the reproductive right of the client, yeah?
Okay.
Even though, but the ethical backgrounds, the legal grounds are not strong to protect us. No, I cannot say that.
Dr. Bamidele, do you have any question for him? Just to
Sorry?
hone in on the issue.
Sorry?
No, I'm hoping Dr. Bamidele will probably maybe has a question for you, or just to learn for us to learn more on the issue you just explained, and maybe if he has a comment or a question. Dr. Bamidele, are you there?
Yes, I'm here. How many minutes do we have more because so that I can close?
We still
I
have
sent
20
2 links
minutes.
to Dr. Onide. I'm not sure, but I sent 2 links to Dr. Onide. And I wanted him to just share it. They're just general web links, and one of them was one of the ones I referred to earlier, talking about the fact that in the last 2 years, 24 doctors in the United Kingdom have had a disciplinary decision against them over medical record breaches. Did you hear what I just said?
Yeah, I hear you loud and clear. So Dr. Shola will share it in the WhatsApp group.
So
you can also drop it.
Sometimes,
okay.
So sometimes it's not just sharing or disclosing information. It's also using information for inappropriate use of medical records. I'll give you an example. One of my research is on Black and minority ethnic doctors, right? And it is on our personal conduct. Now, I'm going to veer off a little bit. With personal conduct and professional discipline, that's an area that I work with, especially in the United United Kingdom with Germany. Many of our professionals are not conscious. You go to a patient's records, you pick up their email address or their phone number, and then you call them up. You get suspended for it, or your license gets withdrawn for it. Amongst the 24 doctors that faced the disciplinary decision, 2 of them were struck off the register. And sometimes it's not just using the information, accessing the information without clinical justification. And when there's a report to the regulator, it puts a problem on you. So the issue is not just sharing the information. It's about even accessing the information. In one of the theories or one of the researchers that has written on medical records, one of the debates that patients' rights advocacy is going into is, and patient safety is talking about whose record is it anyway? Is it the hospital's record? This is my own private medical record, but even the patient doesn't have access to it. How much of it am I supposed to have? Can I just randomly go and check house addresses? Can I just save a phone number and say, oh, I thought to just check up on you and see how you are doing because the patient came to our clinic or our hospital? Would that have been a breach of privacy and confidentiality? If you have shared your number on a particular app, trying to protect yourself from a particular situation, you filled a form when they were asking you to come and donate blood, or when you were supposed to take blood off someone or platelets, and then the hospital starts messaging you to say, oh, this is what you should come to do. Or your facilities, pharmaceuticals, start sending you messages with regards to medication connected to an ailment or an illness that you have just imputed on your phone or on your online, spoken to with your online doctor consultation. So you speak to your online doctor about the fact that your blood pressure is high and that this has been on for some time. You are hypertensive or you are pre-hypertensive. And then you just search Google or you go on Facebook or on Instagram, and then you start seeing ads that relate to that particular illness. Has somebody shared your data? Does somebody have information about you that they are not supposed to have? Now, with medical confidentiality, if you check the first link that I sent, in most of the jurisdictions, access is given when the person lacks capacity. And in most of the cases, like what the doctor said, with parents who want to share information for the care of the child, want to share information for the protection of the person, whether it is for termination or for continued pregnancies. But it is important for you to consider the capacity of the person in question, the patient's capacity. If the patient has capacity to give consent, if the patient has capacity to give consent, then disclosing that information to a third party will be a breach of confidentiality, except you can prove that it is in public interest or it is in the best interest of the patient. And the patient may contest what is in their best interest. In that case, you may have a legal situation in your hands, or a court case, or a professional disciplinary decision determining whether what you did was in the best interest of the patient. And I highlighted something that I had mentioned earlier today, which is the fact that you have good intentions does not count, right? And that the decision of the patient is irrational, that the decision of the patient does not seem logical, is not sufficient enough for you to breach their confidentiality or any of the patient's rights. Remember, it must be in public interest, not what is interesting to the public. In patient interest, not what is interesting to other members of the profession.
Okay.
And so we must build a culture of confidentiality within medical spaces, within healthcare facilities. How much of information is shared? How much of information that is shared is relevant for the care and treatment of the patient? And then importantly, are there reporting systems, feedback mechanisms, or any punishments for persons who breach the confidentiality? If a person feels that their confidentiality has been breached, that their information has been sold, if I fill a form now and I fill a form to receive antiretrovirals, ARTs, I fill a form for the receipt of ARTs to be dropped in my address, and then suddenly somebody starts sending me messages about other forms of treatment for HIV, would I be able to sue the company that sent me the ARTs, or the delivery company, or the website, or any group that has my private information? This is a very wide discussion that takes a wide range of tables. However, I'll send a slide that does like some summary, and then we can look at it as our space. But if you look through that website, you'll find some information. And then if you are in a different part of the world and you want information about what is obtainable in your country, some of our research cohorts might have done something related to confidentiality, or we might be able to go online and search for something relevant for your country, a policy document that's either for your country, for the region, or something that works globally that can be adapted for your country, and then we may be able to send to you after this discussion. But it is important that doctors, nurses, medical laboratory scientists, anesthetists, anybody who is in the healthcare professions must be conscious of the ethical and legal duty to confidentiality. In addition to the legal and ethical duty, they must also now understand what are the variations, what are the modifications of the obligation of confidentiality. There was a time when anonymized information used to be sufficient. If you said, oh, I had a patient today and he had this illness or this disease, that was sufficient. However, some practitioners are having issues with anonymized data or anonymized information, because in some instances, the data or information is easily traceable, meaning that the descriptors, the level of information that you are giving, although you have not mentioned the name, you say, oh, there is a president of a particular somewhere in the Americas who is above 70 years old, who has said he will not be contesting against next year, and I think that he has a terminal illness. He was one of my patients today. Does anybody know who the president I just mentioned is?
Joseph Robinette Biden.
Thank you very much. But did I mention any name?
No, of course, but we can infer.
No, but I was able to give descriptors that showed this. So in some cases, although one of the modifications of the obligation of confidentiality is anonymized data or anonymized information, some people, in trying to do anonymized information or data, you give too much information that puts the patient at risk. Now, for those of us who are social media savvy, one of the last things I want to talk about is social media and advertising. Now, you go on TV recently and then you see some hospitals, in a bid to advertise the hospital, they show some patients either talking about the hospital services, talking about a treatment that they have undergone. In fact, in some cases, you see videos of surgery or surgical interventions being shown in a bid to advertise the hospital. Now, in a situation where consent is not given or properly obtained, note that consent must be informed and consent must be real. We're going to talk about that on one of the days when you do feel like for us to have this discussion. There's an entire LLM on law, medicine, and healthcare, which I did some 15 years in Liverpool. And all of these things I'm talking about is something that we have to learn for between 18 months or between 12 and 18 months. So it's not something that we can do in 1 hour. But let me say that with advertising, social media, and promotions, the consent for that information to be released must be real and it must be informed. So it means that if you are trying to promote yourself as an IVF specialist, you're trying to say that I'm the best IVF specialist in South Africa, I'm the best IVF specialist in Ethiopia, best IVF specialist in Accra, and you want to show the procedure, you want to show something that you have done before, or speak to a patient. If that patient did not consent or did not give informed consent, they did not know the level of information that you are going to give out, that information that you have released may be a breach of their right to confidentiality. So it's important for us to know the legal and ethical duty, the boundaries of that duty. Remember, we mentioned the Hippocratic Oath, the physician's oath, and we also mentioned the Code of Hammurabi. So we mentioned some of the bases that we already have, the background for this ethical duty, and then some of the modifications like consent, like police investigations, or legal reasons. With electronic health records, we also mentioned data privacy protection, EU laws, EPA in the United States, and for example, in Nigeria, where I practice, you also have the Patients' Rights Bill, you have the Medical and Dental Practitioners Act, you have the Code of Medical Ethics, you have the National Health Act, which protect the patient. The same thing with South Africa, the acts also exist, and the National Health Act of South Africa, as well as other policies that protect patients, as well, and the Constitution as well, patient's right to privacy. So in most of the nations of the world, the patient's right to privacy is enshrined in the Constitution. I asked as humans, then subsequently as patients. As patients, especially because patients are in a subservient position, we talk about the imbalance of power in healthcare settings. An healthcare professional is already imbalanced, having a upper hand, using their information will into their of medical actions or use healthcare for more things.
Yeah, Dr. Bamidele, it's a bit difficult to hear
Who has
you from my hand. I don't know if I'm the only one.
Mark has a question, but I
Oh, well, I don't know. I think it's also, I can't hear him again, but we're actually in the last few minutes. I would have loved us to actually also be wrapping up by now. I'm sure we have gained one or more critical things. One thing that struck me is it must be in public interest and safety. I know what's interesting to the public. And I think I have another one here. Consent must be informed and real. And then the capacity of the person to give the consent must also be verified. I know that we will definitely have him again. Today is being loaded and he has shared a lot, and you can palpably feel the experience that he has wealth of experience. As he has said, we want to appreciate him greatly for sharing this time with us and for sharing his wealth of experience with us. I would like us to there's this, if you go to the base of, I don't know if you're joining from mobile or from a desktop. I am joining from a desktop. You can see the ability to react. If you want to react, you can recognize with hand gestures, so you can do a lot of different kinds of reaction, just to show our gratitude to him. uh, Thank you so much. I want to appreciate you. I'm trying to, we can also put thank you in the chat. If you want to appreciate our lecturer today, sorry, he said he's actually in transit. I think he's on his way to Paris for the Olympics, right? So, but he's currently in London, one of the city sides in London. So we thank you for, even despite this, you're still able to make our time to make this a reality, and we've really learned a lot. I want to say thank you from my end. And I hope others you'll be joining me to say thank you in the chat to Dr. Bamidele.
well, I
Thank
mean,
you.
yesterday I had the privilege of I had the privilege of uh, I had the privilege of
Oh, I was hearing yesterday. I had the privilege of, but Dr. Bamidele, I can't hear the completion of that sentence. I don't know if
thank you
anyone
so
else.
much. I dropped a contact question and then I'll send mine and had other details of mine in it.
Excellent.
Can you hear us now? It looks like you were fast for 1 minute. It looks like you pressed 1x on your phone and then your voice was very fast.
Oh, really? I didn't do
Yes.
that, but perhaps
Oh,
maybe it just
okay.
happened. Yeah. But thank you so
No
much.
problem at all. So I'll send across the slides and as well as some supporting documents that you
E-
can find useful for yourself.
Excellent.
I'll also be willing to be a part of this one very soon again. It's
Definitely.
been very exciting speaking to people. I also want us to look forward to more opportunities for people to share their medical legal dilemmas, as some of the circumstances that they found themselves in that they thought they would require ethical or legal solutions to some of those dilemmas like I have presented. Doctors who have faced those dilemmas, who have conquered those dilemmas, should be able to also share their experiences, and then we'll be able to put one or two tops on it. So I'll send a document and then similar links like the one I just sent that can serve as guide. And for those who are working towards drafting a policy for their healthcare facility, they can contact as well, and we can work together to develop something similar. I worked with the Federal Competition and Consumer Protection Council in Nigeria to work on what is called the Patients' Rights Bill, which is a soft document or a soft law protecting patients in Nigeria. And some hospitals also have a patient's rights document. One of them is, which I was privileged to be involved with, is the NSIA Luth Cancer Care Center. I'm also an health advocate, so patients speak to me on a daily basis. I've been a patient in a few countries of the world. I work for patients as well as for medical practitioners who want to be able to express themselves or who have found themselves in a medical legal situation that requires some support. So please feel free to contact or communicate, and I'm looking forward to being part of this again and then sending all of the documents that are relevant to this discourse. Thank you so much for your time. It's been a privilege, and I'm grateful to all the organizers and leaders of the Institute. Have a beautiful rest of the day.
Okay, someone is asking, do you have an Instagram account?
Somebody said no Instagram. I'm not sure whether my Instagram talks about. I do, but I'm not certain whether it talks about medical law. On Twitter, I do more medical law, but I'm on my website as well. I'm putting some of the data that I've gathered in my research. I'm also getting consent to put most of them online. So in a bit, but on Instagram, I'm at Dr. Bamidele, but I'm not sure whether there's medical law or anything like that there. Just very personal life and maybe some other stuff that I do that is present there. But I volunteer for cancer NGOs around the world. I'm part of Cancer UK and the UICC, as well as I'm a blood donor. I ask people to donate blood. So I have patient situations on confidentiality. I'm releasing my information to you. Don't worry. You can share this one. It's not confidential as long as I've given you consent.
All
And what else do I do in healthcare services or in healthcare? Don't worry. This you are now covered, but that's my Instagram as well. Thank you so much for your time. Have a beautiful rest of the day. If there's any other question, we can meet in the DMs or in the emails.
Excellent. Thank you so much.
Thank you.
And for all our participants, see you in 2 weeks' time. Thank you so much. And then Dr. Bamidele is definitely coming back in the month of next month. If not next month, then in September. So thank you so much. We appreciate you. Please do have a lovely evening. Bye.